The risks of having surgery without anesthesia are considerably greater. Now, that's not meant to be a flippant answer. We have plenty of clear documentation of the Crimean War and the American Civil War, where those two wars occurred at a time when anesthesia was in its infancy, and it was uncommon at the beginning of those wars and very common at the end of it. And there's a marked difference between the outcomes before and after the introduction of anesthesia. So we have to admit that we have to put up with anesthetics. We've usually just considered the physical consequences of having anesthesia. What happens to your heart, what happens to your lung, what happens to your blood pressure, and so on. We've more or less sorted those things out now, and we're just beginning to turn our attention to the less common things and things which we didn't used to think were pertinent to anesthesia, and that is essentially psychiatric consequences or neuropsychological or neuropathological changes which can occur as a result of surgery and anesthesia. It's difficult to say exactly. The chances of a psychotic reaction are probably related to a period of intraoperative awareness that may or may not be evident to the anaesthetist or the surgeon, and may show no signs based on the blood pressure or pulse or any other parameter that we might look at. So a long operation, a complex operation, they may be the ones that predispose you to the psychiatric sequelae the most. But again, the honest answer is this is so new on our radar that we don't have the answer in a way that can be supported with either experimental studies or clinical trials. And it's something which we should really be addressing in the future. But first we have to make people aware that postoperative psychosis is a real phenomenon, it's a devastating phenomenon, and it needs to be addressed now that we're looking at the instance of awareness in such detail.